Hi, I'm Dr. Rachel Langley. I practice family medicine here in beautiful Colorado Springs. And one of the things that scares people a lot when they first notice them is a lymph node. So, what is a lymph node? A lymph node, well, first of all, the lymph system is a system that we don't really hear about or talk about. We talk about cardiovascular system, your heart and lungs, and blood vessels. We talk about your gastrointestinal system, all the way from your mouth through your stomach and intestines and out the other end. So, what is your lymphatic system? Your lymphatic system is connected intimately to your cardiovascular system, in that part of the fluid that makes up your blood also goes out into your lymphatic system and circulates there. And it kind of flushes out all the in betweens of your tissues. So, it helps your immune system and white blood cells get to places where infections could be lurking that aren't inside blood vessels, because your blood is really well contained inside blood vessels and capillaries and arteries and veins and all that good stuff. So, how does your immune system get to the places that are outside of that blood? Well, the answer is your lymphatic system. And then your lymphatic system wants to communicate what it finds, these virus, bacteria, little bits of whatever it finds in your body that aren't supposed to be there. It wants to let your immune system know and have a heads up of, hey, is this something that's going on? Is this an all out invasion of this virus coming into our body that we need to gear up and fight? Or is this just a random piece of crud that I picked up and isn't a big deal? So your immune system has to coordinate that, and it uses lymph nodes as little collector areas where a bunch of white blood cells and other immune cells can all collect and communicate about what's going on. I'm making them a lot more anthropomorphized than they actually are. They're a lot more like little machines than they are like little people. But that's what lymph nodes are, is collections of lymph cells in specific places designated for them to be and to collect. And when there's a lot going on, when there's some big immune system process going on, they get bigger. There's more activity there. So what's usually pretty small and you can hardly even feel even when it's really close to the surface, if there's a lot of activity going on there, those lymph nodes will swell up to be about the size of a pea. So that's about 1 centimeter across, and that's it's not going to feel hard. It's not going to feel soft and gooey. It's kind of in between, like a firm sensation, not like a rock and not like an ice cube, not hard like that, but also not like jelly or jello, somewhere in between, like a pea, a lot like a pea. You could squish a pea if you pressed hard enough. Please don't press that hard on your lymph node. So you can have lymph nodes anywhere all over your body. There's places that they tend to be more common in front of your ear and behind your ear. They tend to be close to the skin, so you're more likely to feel them if they're enlarged. Your neck has tons of them, and your armpit and in your groin tends to have a lot. Behind your knees are the most common places that I've seen people find lymph nodes. Sometimes over the back of their scalp too, just because your scalp is such a thin area, the bone is right there. So if there's a lymph node acting up, you're going to feel it. So those are lymph nodes. That's how they're supposed to act. And every once in a while, you'll find a lymph node and be like, well, that one feels really big. I haven't noticed it before, and I don't know why. And so people come in to see me in the clinic all the time for that. No big deal. So the first thing I go through is what else is going on, especially around that region. So a lot of teenagers with bad acne have horrible lymph nodes that act up once in a while as their immune system is trying to react to those small bacterial infections on their face. People with a bad cut or fighting off a cold will have more lymph nodes. If you have a runny nose, a cough, a sore throat, those are all reasons that, especially throughout your neck and in front of behind your ears, you're more likely to have swollen lymph nodes. And they might even be tender, they might not be tender, either is fine. So when you have a lymph node that's worrying you, though, there's a list that I go through of the more worrisome things that could be going on to help me figure out, is this something that we should do a biopsy of sooner, or is this something that we can watch and wait? Because that's really the way to tell if a lymph node is something bad. What could those bad things be? The common things that come to mind are cancer. So blood cancers like leukemia or lymphoma because they're involved in that blood immune system environment, they don't have a mass like a typical cancer does that we think of. They're instead going to be overpopulating your blood counts and building up in your lymph nodes. So having generalized lymph nodes all over the place is more worrisome. So that's one worrisome sign. Another one would be having more systemic symptoms, showing that something in your whole body is going on. So things like fever, chills, night sweats going on for more than a week, or losing weight for no reason, especially once it hits like the 10% mark. If you're losing 10% of your body weight and you don't know why, that's a reason to come on in. So some systemic symptoms, having lymph nodes all over the place that are enlarged, or especially ones right above your clavicles on your lower neck here. Those are more worrisome. People often feel them in their upper neck, and those are generally more not so worrisome. If they're totally fixed, if you poke at it and you can't make it move at all, that's more worrisome. If it's a baby, an infant that has lymph nodes that you can feel, that's more worrisome. If they're bigger than 2 centimeters in diameter, so that's twice the size they're supposed to be, the size of 2 peas next to each other, that's more worrisome. Or if you start getting a workup with your physician and have weird results on your chest x-ray or lab results, specifically a CBC, ESR, CRP, if you know what those are, that's more worrisome. And also if you can't figure out a reason for this, if you have all these lymph nodes or this one big lymph node and you don't have any ear, nose, or throat symptoms or an infection somewhere on your head or some acne going on, that's more worrisome. So things to be more or less worried about. Hopefully I haven't made anyone too anxious. But if you have none of that going on and you are still concerned, this just doesn't feel right, go on and see your doctor. They'll probably go and talk with you about other bacterial or viral things that could be going on, things like mono or CMV or even tuberculosis, some of the less common than a common cold kinds of things that could cause lymph nodes to be big. And there's medications that can cause lymph nodes to be swollen for no reason. In researching for this, I found out that gold, if you're ingesting gold for some reason, that can cause your lymph nodes to be swollen. I didn't know that. But also some really common antibiotics and blood pressure medications can sometimes cause lymph nodes to be swollen, also called lymphadenopathy, in case I say that. Lymphadenopathy means swollen lymph nodes, or even just a single swollen lymph node. So first, rule out the common causes: bacteria, viruses, medications. And some doctors will say, let's give you 2 weeks of antibiotics just to see if that helps. And some doctors will say, let's go 2 or 3 weeks of just watching this and see if it gets better or smaller, goes away. Either of those are reasonable things to do. If that still isn't making things better, if it hasn't resolved, that would be the time when you start doing x-rays in labs that we discussed earlier. And if that is still not showing anything, then you can go on to a biopsy. Usually a really tiny needle is inserted right into where the lymph node is, and then they take a kind of a core sample through that needle. So then they take the needle out, can pull out this tiny little tissue, and put that under the microscope and see what it looks like, whether it looks like cancer, whether it looks like funny looking cells, whether it looks like a totally normal lymph node. So hopefully that set your mind at ease a little bit. I still remember when I was in college, I was in an organic chemistry exam. I found organic chemistry very challenging. And I was in my final exam. I'd been studying, and I was sitting there doing a test question, leaning with my hand against my neck, and I felt lymph nodes underneath my jaw. And over the course of the exam, I convinced myself I had cancer, and so all this studying for organic chemistry was pointless, and I was just going to die in the next couple years anyway. So what was the point of taking an OChem exam? But it turns out those lymph nodes went away just as quickly as I stopped stressing all the time and studying so hard and got some sleep and some decent food. And I didn't die of cancer, thank God. And I'm glad that I finished that organic chemistry exam instead of walking out on it the way I was tempted to, because I was frustrated and convinced myself I was dying. So on that happy note, hopefully I've set your mind at ease a little bit. And if you wouldn't mind, I think you'd like that video too. And please subscribe to me so you can see the other videos I post when I post them. Thanks for watching.